Hi, we're here today in Portsmouth at the John Pound Centre for our 5th Integrated Care Partnership Assembly for Hampshire and Isle of Wight, and the subject is on trauma-informed practice. We all know that if people experience trauma, their outcomes, both in terms of health and wider care outcomes, are a lot worse. So what can we do as partners to really work together to work with people, support people who have been impacted by trauma in their lives, and how we make the outcomes better for them?
So trauma-informed approaches aren't just a nice to do or an added bonus. The evidence is really loud and clear that if we can protect people from the impact of trauma, if we can prevent adversity happening in the first place, which can lead to trauma, perhaps through that superpower that is the first 1,001 days of life, good attachment in early years, consistent loving adult caregiving. If we can recognise trauma in ourselves and each other, it's not just them and us, it's about all of us. If we can respond in a trauma-informed way, and that means 6 principles of trauma-informed practice, which are choice, collaboration, empowerment, cultural consideration, safety and trust. And if we can resist re-traumatising each other, then we have a huge opportunity to reduce demand on the NHS, reduce homelessness, reduce drug and alcohol addiction, reduce crime, reduce CAMS waiting lists for our young people, help young people stay in school, get a good education, get better paid jobs, improve mental well-being. It's there, the evidence is there, loud and clear. Start with trauma and you won't go far wrong.
Hi, I'm Sue Pennant, I'm the CEO of Rockpool, and I'm delighted to be here today at this assembly, and I'm here primarily to support my trauma-informed practitioners. These are some staff that we've got in Hampshire with the police, and they go out in cars with police response officers to support the police to become more trauma-informed in their approach, with a view to hopefully reducing particularly the number of young people that might be coming into custody. They work alongside the police, go out on the response cars, also review body-worn cameras. It's been a fantastic day listening about the trauma-informed work that's going on in this area in Hampshire and the Isle of Wight, and I hope this is the first of many other events.
So at SSJ, within our integrated offender management housing, when individuals move on, so we can create a home and safe environment where people take responsibility themselves. We bring people in, we show individuals around the house to make sure it's something that they would feel safe and comfortable in. We allow them to choose what colours they want for their room, help them furnish it and decorate it, and we also develop a recovery plan where they have full participation, and we include relevant others and partners involved in it, which then means that that person takes ownership of it. It's collaborative, and the resident trusts us to be boundaried and create a safe space for them to flourish and prosper. And this means that within the 94% of individuals who live within that environment do not go out and commit crimes because they have no need to, and they have an alternative and safe place to live and prosper.